Our health service has a program called Care in the Right Setting. It's about delivering the right care in the right place at the right time for a patient. Hospital in the home is a way of delivering care to a patient at the inpatient standard, using nurses to visit on a daily basis, and also oversight by a medical officer. Using virtual health monitoring enables patients to be discharged earlier than they otherwise might, being confident that they'll be looked after at a sufficient standard whilst they're at home.
So when we onboard a patient onto Hospital in the Home, we have our nurse and our virtual health technical support officer to provide information to the patient about our Hospital in the Home program and how the virtual health monitoring equipment works.
So patients will do their monitoring of their vital signs first thing in the morning when we set them a task, and then our clinicians will rapidly review them when they start their shift.
So the information we can receive back from a patient on a daily basis is observations such as blood glucose, blood pressure, temperature, from a quantitative perspective, and then from a qualitative perspective we have the opportunity to receive information that's specific to their care needs and the condition that they're in Hospital in the Home for through our health check questionnaires.
So those patients will receive a follow-up video conference from our senior medical officer.
We then go on and perform a daily home visit that's provided either from our nursing and or our allied health team.
And then to close out our shift, we normally have our patients do an afternoon set of vital signs, and then our staff will review them prior to finishing their shift.
Our Hospital in the Home service looks after adult and paediatric cohorts from a range of conditions referred to us from the medical, surgical and orthopaedic specialist teams.
In traditional Hospital in the Home services, the patient is somewhat remote from the hospital, meaning that their vital signs and how they look and feel aren't being engaged with on a daily basis. With this program means that we can keep a view of the patient's vital signs and how they're feeling and looking.
So virtual health monitoring has enabled us to have an extra layer of clinical comfort and oversight for our patients. It's enabled greater clinician confidence in terms of referring into our service for more acute patients that otherwise traditionally probably wouldn't have been referred to a normal HIS service. It's also given us greater access to these patients on a short notice, so we can do very rapid clinical reviews of these patients with use of video calling. We can also pick up clinical deterioration much quicker than usually.
So the patients within our Mackay Hospital in the Home service have reported back benefits of increased confidence in the fact that they know there's clinicians checking their data on a regular basis, and then this in turn is helping to improve their health literacy to better understand their current and chronic health conditions.
I'd been in hospital for 2.5 weeks. Well, I had a pump pumping into a PICC line into my arm for antibiotics for a 4-week period, and that was really essential. Had it not been for Hospital in the Home, I would have had to go in every day to have a pump or stay in hospital for a month. Well, it's pretty straightforward. I was able to just open up my app and log onto the hospital and record my data, and it just automatically was transferred to the hospital via the app. And it gave you comfort that you were in contact with the doctor every day. I think it's far better than spending time in hospital when you don't need to be there.
Patients jump at the opportunity to leave hospital early and be receiving care in their own environments, surrounded by their familiar things and their loved ones and carers. Well, certainly the future holds lots of promise for Hospital in the Home. We can deliver care to our rural patients in their own communities using virtual means, but also, as time goes by, the numbers of patients and the types of cases that we look after will almost definitely expand.